So before we go any further, I want to acknowledge with humility that I am speaking to you, and the NCCDH is located in Mi'kmaq, and that is the ancestral and unceded territory of the Mi'kmaq people. So I am sitting right now in a town that's colonially known as Antigonish, Nova Scotia, at our host institution at St. FX University. And as I think about land acknowledgements, one of the very recent learnings that I've had, and recognizing that last month was African Heritage Month, at the time that these treaties were signed, Black slavery existed in Canada. And so there are groups of people who relate very differently to this land acknowledgement, and in the case of African,
cette reconnaissance territoriale de façon très différente. Les esclaves
were considered property, and that is a piece that I've been carrying with me for a few weeks, and as I think about and I reflect on the land acknowledgements. So I want to acknowledge that also with humility, and I want to extend this gratitude for knowledge and sensitivity and relationship to all First Nations, Inuit, and Métis communities across Canada, coast to coast to coast. And with that, my speaking time, I think I'm going to go ahead and turn it over to our co-host, who's Leslie Dyke. But before I do that, I want to let folks know that there should be a link appearing in the chat box to sign in for Slido. We will have a couple of polls that will come up in a few slides from now. And if you can log into, or not log in, but if you can click on the Slido link and enter that number, then you'll be able to participate in the polls. And so, Leslie, did you want to speak to this, or should I do the purpose? I guess it just dawned on me now.
No, I'm very happy to jump in and take this. Basically, you start the hosting of and the sharing of the conversation. So my name is Leslie Dyke. I am a independent health promotion consultant. I'm based in British Columbia in the beautiful Okanagan Valley, traditional and unceded territory of the Syilx people, for which I'm very grateful. And I have a lot of appreciation. So up front, I want to say thank you to the National Collaborating Centre for Determinants of Health, and for being such a great partner to Health Promotion Canada. We're a volunteer-based organization with no staff, so really relying and using partners is really essential to support the work that we have been doing. So NCCDH has been a brilliant partner. So I want to start by saying, great appreciation. And I also want to start by welcoming everyone, and just to say, we're honestly a bit overwhelmed. When we started into the data collection and the creating the survey, and then wanting to share the results of the survey, we honestly started all of this. This is some 4 or 6 months ago now. Thinking that basically Health Promotion Canada had run its course, that there wasn't interest. And we were kind of thinking, are we the only ones left in Canada that really want to be part of this conversation? Oh, we are so wrong. That's not the case. So I want to express appreciation for everyone who's here today and all the people who have been part of helping us and responding to the survey. So this is really quite huge, and we've got a lot to take away with us, I'm sure, by the end of this conversation today. So today is really to focus on sharing the results of the survey. We did some discussion groups as well, so we're going to talk a little bit about that. We want to also take some time to explore opportunities for increasing the application of a health promotion approach in academia, in public health, in the community, and other sectors. And we're just going to start that exploration today because it's only a 1-hour webinar. So just to say that we're starting that, we want to hear from you, and that will give us some good information around how to proceed. And this is also the very beginning of creating what we're thinking is going to be a network of networks. We recognize that there's lots of enthusiasm and commitment to health promotion in Canada, but the structure and the way that we've approached it as an organization has maybe not been connecting really well, and we need to rethink that. So this idea of networks is something that we want to talk a little bit more about with everyone. And so we're really looking forward to connecting again further in the future, and just we'll end up probably just scratching the surface a little bit today. So as Diane said, the slides will be available, the recording will be available, there'll be a feedback form, you'll be asked to give feedback, there's going to be a sign up list, there's going to be lots of links coming into the chat, so please do keep your eye on the chat. We want to make this as interactive as possible. But because we only have an hour, we're basically going to use that first half hour to share what we learned, and we'll have some questions for clarification. But then the last half hour, we're really going to be focusing on hearing from you, some small group discussions and things like that. So that's what we're looking at right now. I'm just going to, oh yes, how do I advance the slides? I guess I can't, can I?
I do, Leslie.
You do it. Okay. All right. So if you can just advance to the next one. I think this is the time where I introduce my partner in this endeavor today, just one of our many volunteers, and that's Kevin Churchill, and he'll be speaking in just a moment. I'm going to hand it over to him. He is a manager in clinical and family services at Lambton Public Health, which is the Sarnia region for those people that are not in Ontario. And then also, I want to mention about the people that are attending today. We don't have time to check in with you to see where everyone's coming in from. I'm noticing in the chat that there's lots of people posting to say where they are. Hopefully you're seeing lots of your friends and colleagues, and you're able to message back and forth. But the National Collaborating Center, when they sent out the registration, they asked people to say, you know, where are you coming in from, and what's your interest? And we have huge diversity from all across Canada. Really, really excited about that. Of course, the largest group is from Ontario, but I'm pretty sure that's population related. Out here in BC, we're a close second, but we have registration from all across. So I'm really looking forward to this conversation. The other thing just to mention by way of disclaimer, thank you everyone for putting, when you registered with NCCDH, adding information around the kinds of things that you want to talk about and discuss and explore. And there was lots of very specific health promotion topics. Today, we're not going to be going into health promotion topics per se. We're looking at the breadth of health promotion in Canada and how to support it as a movement, as a network, as an organization. But you've given us lots of really good ideas around where there's some interesting topics. So I am going to ask Diane to advance the slide one more, and I'm going to turn it over to Kevin to give you a little bit of background because he's been in it since the beginning. So he was the natural person to speak to Health Promotion Canada, just in brief.
Makes me feel old, Leslie, but thank you. And yeah, it's my pleasure to be here today. Hello, everybody. Good morning or good afternoon, wherever you are. So just quickly, in terms of where Health Promotion Canada started, it was launched officially in October 2016 and formed from a national group of volunteers that was called the awkwardly named Pan-Canadian Committee on Health Promoter Competencies. And this group worked closely together through 2009 to 2016. And their primary focus was to engage the health promotion community in the development of a set of discipline-specific competencies for health promoters based on the foundational work commissioned by Health Promotion Ontario. And this included a literature review done by Dr. Brent Malofny in 2006, and an environmental scan done by Brian Heineman in 2006. And that work was funded by the Public Health Agency of Canada. Moving along, HPC has a national volunteer executive team consisting of representatives from each province and territory that helped build a national collective when I say that, we're missing a couple of territories currently, but I think we have had some representation from the territories along the way. And usually HPC is been involved in activities including promoting those competencies and sort of a knowledge sharing piece with the competencies, but also awards, national awards. We may have some of our award recipients, over the years on the line here today. I hope we do. In further learning opportunities, including a number of webinars that that NCCDH has always graciously hosted and helped us to facilitate as they are today. And a big shout out to Irv Rootman, who's on the line here and has been, as most of you will know, such a for parent of health promotion work in Canada, and literally wrote the book that I think a lot of us probably studied in our undergrad and graduate work. So COVID-19 really took us all, I think, by surprise in terms of the length of time that it was active and continues to be, and was a bit of a shakeup or a wake up for some of us working in health promotion in terms of the speed in which our work became all of a sudden less important than some other work in public health. And but to credit to Leslie and the people on this group, we did manage to continue to work together through COVID, and it was a good period of reflection for us as a group, and brought us to where we are today. So I'll leave it there and move to the next slide, please.
Great, thanks, Kevin. So the next slide is just reinforcing what I mentioned. We're going to spend about 20 minutes sharing what we learned in the survey. Then we're going to go into some small groups for 15 minutes, 10 minutes in small group, 5 minutes to hear back around what your chat was about. And we're going to break you randomly with a separate group for our Francophone friends. We'll get to that in a minute. And then at the end, we're going to talk about priorities for next steps. So that's the process for today. Hopefully, most of you can stay for the entire hour. Next slide, please. So what we did in a nutshell, and what we're here to talk to you about is the survey, electronic survey that we sent out, and then the discussion groups that we hosted. And I think the most important, well, there's a couple important things I want to reinforce. Oops, is just the numbers. We, like I said at the beginning, we were quite uncertain. We thought maybe there wasn't an appetite or interest, but I think that getting almost 200 surveys returned, and having 30 people attending the different discussion groups, and then what we heard in that we're going to report on today, there's a lot of energy and enthusiasm for health promotion in Canada, and there's a real hunger and need to connect. And so I think it's really going to be about how do we do that. The other interesting thing that I want to point out, we had really excellent diversity in people who filled out this survey. We had good representation across all ages. We had excellent representation across all of Canada, different geographic areas, different roles. It was really reassuring to see that. It was very positive. The challenge, oh, and also from a diversity perspective, we asked people to share those areas that will help us to understand or interpret what they were saying. So we asked them to just share with us what do we need to know about them, and we had many responses talking about diversity, equity, inclusion kinds of markers. So we feel really comfortable with the diversity of responses that we got. However, it's really interesting for us to notice that we sent it out, of course, to all of our Health Promotion Canada members, and then all of the huge network that we have of our colleagues in health promotion. Very few of the people who responded were actually members, and really, barely a third of the people who are paid members responded. So that we found that a really, really interesting thing. So thank you to everyone for responding. I'm going to move on to the next slide. Just in general, what we're going to just before we go on to what we're going to talk about, we actually want to ask you a question. And that question is about how important is it that we have a national health promotion organization in Canada? We heard in our survey that it was important, but we want to hear from you. So this is where you need to go into your chat. You need to go into the Slido using whatever browser. You need to enter the number, which is in the chat, and then you can enter your response. And everyone should be able to see the slide in front of you. It should be coming up. You can use your mobile device as well and use QR code if that is easier than doing it on your computer. All right. So we are not seeing anyone say that it's not important. And we see some people kind of going, yeah, neutral. All right, which is really good to know. Obviously very important. And so huge appreciation for everyone for being here, because I think this is where we start our discussion. So thanks very much for that. So let's move on to the next slide. So this is what we're going to share with you today. We're going to share the results of the question we asked about personal reasons for why you responded to the survey, the benefits and barriers that were identified, the functions and structures that were, and the importance of different functions and structures, your experience with Health Promotion Canada, the feedback you gave to us as an organization, and then some next step ideas for moving forward. So that's what we're going to share with you today. So let's move on to the next slide. And let me share the personal reasons. So this is what we heard. We asked, because we really wanted to know, like, why are you taking the time to fill this out? And frankly, we figure we had a retention rate of somewhere 75–80% of people who started the survey finished the survey. That's quite good. So people were really there and answering the survey because they felt it was important. And this is what we heard around raising the profile, enhancing credibility, maintaining knowledge in the field. They feel that's really important, staying connected to colleagues, also really improving the overall system. And I think that was really connected with COVID. People really saw the importance and the value of health promotion for this time that we're in right now. And then of course, the continued support and investment in upstream prevention and health promotion. We really need to reinvest. And that's actually part of what we at Health Promotion Canada, what we want to do as we rethink, what the organization, how we can reframe the organization to invest in this wonderful community that we're all a part of. So that's what we heard in terms of the personal reasons. So we also asked about benefits and barriers. So that's the next slide. And I'm going to turn this over to Kevin to speak to just at a really, really high level, the benefits and barriers that we heard from you with respect to a national organization.
Okay, thank you, Leslie. So we asked the question, what are the three main benefits of developing a Canadian health promotion organization? And, a wide range of responses, but starting with the fact that there is a model that exists, in the Ottawa Charter, and that, despite the fact that it being 30+ years old, it still rings true and is something that we can point to. The second is education and training, and we've seen a great deal of growth in terms of education tools and resources that are in a Canadian context around health promotion and competencies and standards, and improve recognition of the and understanding of health promotion as a practice, which brings credibility to the work in the profession. Where people saw opportunities included with academic institutions and community partners to develop basic guidelines that would be applicable across provinces and territories, and coordinated voice for health promotion to help bring credibility and a national voice on critical issues. And number 4, leadership, including leadership from other disciplines that apply health promotion principles, including gerontology, kinesiology, social work. And lastly, one of the main benefits is to work together on advocacy. And I think that speaks for itself. The next thing that we asked about are what are the barriers, and it's interesting that the responses that we got to this question were fairly consistent, or we were able to theme quite well. So barriers, the number one barrier that came up again and again and again was funding and capacity. In the fact that we're all, most of us are doing this kind of work really from the side of our desk, so to speak, in that it's a volunteer effort. We all have other, day jobs, if you will, and as passionate and as committed as we are, it's other things happen in our lives and in our work that need to take priority. So that was a consistent one. The other barrier is just that the scale of Canada as a country and the ways that the various provinces have different ways of operating and structuring public health. So that there's I think benefits in the diversity of that, but it also makes it challenging to work across a country where Leslie has to get up super early just to meet with us at lunchtime in Ontario. Not that it revolves around Ontario. And then another barrier was just the lack of clarity around vision, mandate, purpose, and role. I don't think that Health Promotion Canada has articulated that as clearly as we would like to be, and we certainly heard that. And then the last barrier is just communications and engagement, and I think that's that makes sense. People want to hear more communication and are looking for opportunities to be engaged, and obviously we're seeing that here today. That's it.
Great, thanks, Kevin. So we asked in the survey about 5 different functions. So before I share the results from the survey, we thought we would find out from everyone here about your judgment around which functions are more important than other functions. So you'll see in the chat box, there's the code for Slido. So if you go into your browser, go to slido.com, put in the code, and then you'll be able to click and you'll be able to suggest what order you would put these 5 functions. So these 5 functions include, networking, finding other health promoters and organizations to partner with, learning and staying up to date, so that information, tools, and techniques piece, collaboration, action, advocacy, and health promotion issues, and also recognition of your own skills and expertise. So if you were going to put these in order from most important to least important, what order would you put these in? So let's just see how similar the audience here today is compared to what we saw in the survey. So we can see that the collaborative action advocacy is neck and neck with the staying up to date. So that learning piece and advocating, communicating is clearly really important. You can see that networking and then collaborating with other health promoters is also important, but is a little bit further down the scale, and then recognition of my skills and expertise. And interestingly, that skills and expertise is very important in some contexts, is what we learned from our survey, and less important in others. So it's not that it's not important, it just seems to be the context within which the health promoters working seems to be what's important here. So thanks for everyone jumping in and adding your thoughts there. Let's move on to the next slide. And we will see the important functions. So Kevin, do you want to provide a little interpretation to this slide?
Sure, and it's interesting that, you know, we just asked a similar question, and this, you know, those responses, you know, map pretty closely to this. There's a little bit of difference here, but you know, that networking and with others came up high, and connecting with other health promoters and health promotion organizations, again, very strong, and learning from each other, and staying up to date on current research tools and techniques was next. And the recognition of skills and expertise, and we've had many discussions over the years about pros and cons, pitfalls of credentialing and those kinds of things. And so that's a whole other webinar, but obviously that's important to people as well. And then again, the collaborative action and advocacy on larger health promotion issues. So there were other functions identified that don't show up on the table, in things like strategic approach as a discipline or a specialization, linking to collaborative action and recognition, aligning stakeholders and decision makers, securing funding from the range of vested partners at all levels, governments, NGOs, and then others identified health promotion curriculum and evaluation linked to learning and research, and knowledge dissemination, and lastly, media, and having a presence in promoting common health promotion messages.
Mm-hmm.
That's that.
Yeah, because we asked people to suggest, you know, what other functions might be important, and those are the things that you also, respondents also added. And I think that actually creates a really big challenge, and I'm going to be very interested to hear that after your small group discussion, whether any of you wrestle with what is the role of a national organization, and if those are all important functions, is that really a reasonable thing to expect from a single organization, national organization, and to what extent? So it was really, really quite interesting. So thanks for that. We have another survey question for you. We also asked about structures. So functions are one thing, you know, what's the purpose and role of the organization? But structures are really the how. How do we get our work done? So we asked about that in the survey, but again, we thought we would check in with this group here. So same thing, go to Slido, put in the code, and start thinking about which of these 6 structures do you think is most important, and then order them down to least important. So it's everything from online network platforms, website. Oh, it keeps jumping around. Okay, so I've got to look at a different slide so that I can actually read it. Online network, website, individual membership fees, organizational membership fees, a governance structure, which we've been kind of operating like a board governance structure, working groups and committees. So these are all structures that will help us to do what it is, you know, fulfill the role of the organization. But we really wanted to know from you, what is the most important? So just glancing at the responses that are coming in, yeah, it's kind of going back and forth between this idea of an online space and working groups, committees. Yeah, this is one of the things I love about being part of a health promotion community. People are very practical. It's very much around, how do we get it done? We're going to get in there and we're going to get it done. And I can really see that this idea of working groups and having an online space, because at a national level, it's very hard to operate unless you have an online space. Website is kind of an example of an online space. Thank you for putting governance structure somewhere in the middle. So this is part of my passion and part of the work that I do as a consultant. It's not just health promotion, but I also support nonprofits. I do a lot of work around governance, and it's so important, that structure, in supporting the success of the organization. So thank you everyone for recognizing that. Interesting membership fees are ranked down there. We're gonna look at what response we got in the survey in just a second. And then last is the individual membership fees are least important. And that's really interesting, because we've been actually, a lot of our conversation has been about, are we a member organization? Should we be a member organization, or should we be something else, like a network of networks? So let's go to the next slide, and we'll share what we heard back. No, the slide, this is the important structures, I believe, is the next slide. Back a slide, I think. There we go. Okay, important structures. So we asked about those 6 structures. And as you can see, website and online network platform came up at the top of the survey. So not that different from what we heard here. But the online survey, people were really prioritizing that space. And then governance structure and working groups. Those were the 2 that kind of fell into the middle. So again, working groups came out a little bit higher, I think, today, but they were quite high from the survey, as you can see. And then mixed feedback on membership fees. Which is really part of the challenge, because I think one of the reasons why people don't know about or haven't known about Health Promotion Canada, and one of our challenges in kind of keeping the volunteers organized and moving, and Kevin alluded to this at the beginning, is we have so many demands and we're doing this as volunteers, and if you can't actually pay staff to at least provide a little bit of that capacity support, it's really, really hard to leverage volunteers to the fullest capacity. So if you don't have membership fees coming in from organizations or individuals, where does that resource come from? So that's going to be, hopefully, again, part of the discussion that you have in your small groups. Okay. So let's move on to the next slide, because I see, yeah, we've got to get into the small groups. We've been spending a lot of time chit-chatting. So the last little piece of information to share with you is what we heard about your experience with Health Promotion Canada. People are coming to webinars, and, you know, again, as Kevin said, the partnership with NCC has been really valuable. People have been using the competencies, but not a lot of people have been using the toolkit. It's only accessible to members. That was part of the way the organization was set up. And then we wondered, well, maybe people are getting health promotion support from other organizations. So we said, what else are you a part of? And the usual, you know, significant public health type groups were right up there. But then we had a huge collection of other organizations that were named that when we took a look at them, they're not technically health promotion organizations. They're more discipline specific focused. So we don't think that there are any other health promotion organizations that are trying to do what we're trying to do. The only thing that I want to point out here, because I'm going to move us to the next slide right away, is that I think there's a really good consensus that health promotion is everywhere, that health promoters are very diverse, but that our current situation around growing health inequities has got us worried. And we're also worried about the future of health promotion as a field. Now, the solutions that have been coming up are, as you can see, the leadership, the collaboration, the getting the resources, spaces where we can do the work. And that's what we're going to get you to talk about in your small groups. So, and I start to see people are starting to pop some thoughts into the chat, which is great. So we did set up a Jamboard to collect, but it's going to take a lot of time to get over there and back again. So I think what I'd rather do is I would just invite people to put up your hand and indicate that you want to jump in and say something, and also to post into the chat. Because as I said, we're going to capture all the chat and we're going to share that back to people. Any reflections you have from your discussion that you had with your small group, and any ideas that you have with respect to our best next step, because that's really the next conversation that we need to have. We need to figure out the kinds of things that we need to do. So putting your thoughts into the chat will be really helpful. We'll scroll through them after. That will help us, do that next bit. It's really great. Yeah, sorry, Diane.
I put my own email in the chat box. So if folks wanted to email it to me after today, if they don't have time to do it right now, that would be great. I'm happy to compile them.
Yeah, and I'm seeing many friends here, one of which is Ian's note from CPHA. Thank you, Ian, for saying that, we will help, and the NCCs and NCCDH has helped. And I feel like we're at this place where we can come together and find a way to do this. Oh, and Lori's just popped. Oh, nice to see you here, Lori. She's just popped in, establish health promotion in population public health systems. Yeah, exactly. I think people are really seeing a place for that. A national organization for advocacy. People are just finding out about the group today. Exactly. And so I feel like this is a renewal moment, which is really, really helpful. Does anyone want to put up their hand and unmute and I mean, we have a lot of people here, but if you're interested, if you're willing to jump in and say any reflections from your group, we'd love to hear it. And Diane, actually, maybe this is the time to advance to the next slide. And I will also go into the chat and I will copy the hyperlink and I will put it in there and post it. So the hyperlink that just went in the chat is the sign up list. So anyone, it's a Google Doc, just so you know. So anyone who wants to jump in, if you got a notification of this, you're going to get communications from us in any case, but if you're willing to jump in and help us out, that would be great. So I'm just going to keep looking. Oh, Andrea, nice to see you here. Plans update core competencies. Yes. And absolutely. Public health is doing that as well, broadly, not just the health promotion, but because yes, there's things missing like cultural safety, decolonizing, anti-racism, 100%. Yeah, really great.
So Leslie, we do have two hands up. I think if folks are super quick, we can probably do that. Simon and then Trevor.
Hi there. We had a small group, but just a really interesting discussion because it was focused on one issue, but it actually linked to what I think is such a broad issue for health promotion. And the one issue was one of the ones that was seen as less important in our poll, and that was recognition and credibility of health promotion's practice in the field. And I think that the reason that we get this paradox is that it keeps coming up, but people don't like to make it a priority, is because health promoters are not in general careerist types. And so what they're really concerned about is the recognition of what health promotion is and the scope of practice, so that when they're in an organization, people know what it is that they're doing, support the work of health promotion, and don't actually distract them into doing non-health promotion related things. And the last thing I just want to say quickly is we ended up tying at the end to the really lack of community participation and involvement in health systems. That's only gotten worse over time. We have lost our way in terms of connecting the strength of communities to governance of health systems. And that's something that I'll just leave it there. Interested to see what Trevor has to say.
Yeah, no, that's great. Thanks, Simon. We heard a little bit of that in the small group I was in too, about the importance and how COVID has impacted. And yeah, that's great. Trevor, do you want to jump in?
Yeah, very quickly. Hello, everybody. We had Jessie from Swan Lake in Manitoba in our group, and I'm not going to put words into her mouth, but the sense I got from her that I put in the chat is part of it is why has the health, do we understand why health promotion has sort of fallen off the radar? She was saying people in the health authorities don't understand it, so they don't support it, they don't see what it's all about. Have we done the analysis to understand why health promotion has fallen off the radar so that we can put it back on the radar? The second thing is she was talking about working very much at the local level with community health development. And the question in a sense is who will build the capacity of the capacity builders? So I got the sense from Jessie that she felt a need for capacity building for her own people and staff who are themselves the capacity builders in the community. And so that raised the question for me of why would people join Health Promotion Canada? What do they get out of it? And there's visibility and all the rest of it, but training and competency building seem to me something that is also fundable. So if you're looking at a revenue stream, there's a revenue stream. And I don't know to what extent, because I haven't been involved that much, that is already happening, but it does seem to me that a national competency building is a potential revenue stream.
Yeah, thanks for that. I think it does come back to resources. So our small but mighty volunteer group will be meeting. Thanks everyone for your time today. In the slide document, the PDF that we've created, the emails for all of us are there. So anyone who wants to be in touch with us, you will hear from us again, because as I said, we need to decide what's next for Health Promotion Canada. That will be in your inbox in the not too distant future, because this is what we're working on at this very moment. So that's it. We've run out of time. Our hour is up. We are extraordinarily grateful that everyone was here today and want to say thank you very much.